Hi guys, this is Ifechi of the Campus Lifestyle, who also happens to be the General Secretary of BUAMS. We are currently in the middle of the BUAMS Health Week, and today we have a panel session featuring some very esteemed guests in our midst that are very prominent in the health industry, and we would like to speak to them and hear some of their views on certain aspects of life. So with me here today is someone that we all know, the bearded Dr. Shino, and he has graced our presence today. So sir, how do you feel to be here?
Okay, I feel very excited. It's my second time in Ilisharam. I think I was here like 10 years ago as a medical student where we came to beat Babcock at a quiz competition. I was the president of the quiz club there. So it's good to be here 10 years after, and I'm really excited to be here today.
I'm so glad you are. As someone that's active on Twitter, I always interact with your tweets. I always see the bearded Dr. Shino. So how did you come out about that name? What inspired the name?
Okay, thank you very much. I think that's a question everyone used to ask me because I feel that name is like very ridiculous. So it started as a medical student. Then when we had all of these one simple strands of beard where you put cream and all of that. So I just started something funny, bearded Shino. You understand? I used to be on like very active on Instagram then, just be posting just small things. So when I became a doctor, I just say, okay, I'm a doctor now, bearded Dr. Shino. Then I was not on Twitter, so I think like 2020, I joined Twitter 2020. So someone just said, just join. So I just said, let me just put the name. So I made one post one day, and the post just went viral. Bam! So that was my first break. They, oh, okay, bearded Shino. Okay, let me just stick with the name. And I think I go with brand endorsement, like. So I had to stick with it because the contract I signed had that clause in it, and you cannot, just change. So that was the origin. I think, people really kind of liked it or something, and I just stuck with it. So that's the genesis.
So before you blew up the way you have blown up today, did you always see yourself practicing clinical medicine?
Oh, I'm still practicing clinical medicine. So I'm a resident doctor with interest in neurology. So I'm still, apart from the whole, though I don't put that out on media because, yeah, well, I'm still practicing clinical medicine. I still see clinics. Even many of the students will know that I still teach them because they do rotations in my center. I'm in internal medicine. I still have sessions with them. So, I won't say I envisage like this because deep down, I'm very, very introverted. Like people don't know, but being out there in the social media space, I think the trajectory just changed. And okay, you just flew with it, and I'm really very happy because as a young Nigerian, people will ask you, why are you in Nigeria? I mean, why can't you jack by all of this thing? But when you see what you're doing, it's exciting that you're doing something different. That the young people making a change, and people are so happy, and so I think I'm super excited about the whole thing.
Dr. Wale. Okay, Dr. Wale, how do you feel?
I feel happy, yeah, and excited.
First of all, how did you get here? Like, what inspired you to be a health influencer?
Okay, for me personally, I think the idea has always been about impact outside the consulting room. So when I finished my studies back in Europe, came back, I realized that one of the problems I faced was each of the patients coming to see me had to spend a lot of time explaining things. And that was a concern. So I felt, okay, how can I actually make this better? How can I actually solve this problem to make people more literate? And then another thing I noticed was that people came in late for very simple things, right? So for instance, during my pediatrics posting, I saw a child come in. It was malaria, but the child died, cerebral malaria, because the child presented late. So I felt that, is there a way we can let Nigerians know or Africans know that some of these things are actually putting their lives at risk? So I felt that, okay, there is a lot more work to be done with awareness, literacy, and sensitization. So that was what took me into this, but I didn't really, know how to get in. So what I began to do was that I started to polish my skills in different things, such as, knowing how to shoot videos, knowing how to edit videos, knowing how to post videos, knowing how to make use of social media. So that took me like that from when I finished. That was in 2016. So I started taking interest in that, taking skills, video editing, building a team around it. I also worked with other people who are also prominent behind the scenes, helping them to build their own content. Then in 2019, I came into the spotlight to start making my own videos. So that's my journey. That's how I got here.
I have with me here Dr. Muyiwa. Tomiwa, how do you feel?
But I'm excited. It feels good to be back to Babcock University, right? Yeah, I schooled in Babcock University, so yes, I did 6 years here. So it feels good to be back. It's the first time I'm back since I left. So yeah, I'm pretty much excited, and I'm excited to be around with such notable people, right? And also just giving back to BUAMS. I think that's what. Yes, yeah.
Okay, now, like, what's interesting me now is how you came up with your name. Like, why Wolf of Broad Street? What inspired that?
Yeah, so many people have asked me that question, and to be honest, initially it was just a joke, right? It was a nickname. So I did my internship at Lagos State Health Service Commission on Lagos Island. So it's on Broad Street in Lagos Island. So then me and my friends used to joke and just talk about the qualities of guys there. So we have wolves, we have sheep, so we have all of that. But then, so the name came up, Wolf of Broad Street. But that was just the joke part. For me, I now had to define what it meant for me. So the wolf represents my personality, and then the Broad Street, my vision for the healthcare sector.
So, what's your vision for the healthcare sector?
So yeah, whenever I talk about universal health coverage. So for me, I'm building something. It's called Broad Street, a healthcare market, and what it represents is just trying to add my own value to progressing Nigeria towards universal health coverage. So for me, that is coming in a form of a solution within the healthcare sector in Nigeria, which is going to be called Broad Street. So I recently incorporated my company called Broad Street Tech Consulting Company. Yes, thank you very much. So and then the Wolf of Broad Street just puts everything together, my personality and then my vision.
So you say you're the solution to the problems of Nigeria.
Not the problems of Nigeria. It's just adding my own potential solution. So I can't say that that's going to solve the problem now. It's not going to. It's not going to. But the hope is that it will actually make significant impact towards achieving that.
So you said you still practice. So how does being a health influencer affect your approach to practicing medicine?
Well, I would say that it has its mix. Okay, so for instance, about 2 weeks ago, I got into the hospital, and one of my doctors was seeing the patient, and then she was busy screening the patient, and I was like, "Oh, sorry, I wanted to step out." I was like, "Oh, are you not the doctor?" And I'm like, "Yes, I'm the doctor. Please, don't tell anybody that I work here." But yes, it's interesting sometimes, and then it's also beautiful at the same time because it makes my work easier. So for instance, if I see someone and maybe I've spoken about something in pregnancy, there are so many things that I've spoken about, like for instance, maybe hyperemesis gravidarum. So there are cases where I have spoken about it. I just tell them, go watch my video. You will have more knowledge. Yes, and it makes it easy. It actually makes it easy. So I find it a bit interesting because those are the areas where things actually get better, because many people get to see those videos and they are more educated before even coming to see the doctor, or after seeing the doctor, if there is not enough time, they can get more enlightenment on it, and then they can ask relevant questions when next they come for follow-up.
I think the final question I have for you is, as someone who has struck a balance between being a health influencer and practicing clinical medicine, how do you balance the two?
Okay. Trust me, it's not easy, because apart from that, I also am a co-founder of a health tech startup, and yeah, I'm also, as you can see my badge, I'm also into NMA politics. I'm the current acting Public Relations Officer of the Nigerian Medical Association of Ogun State. So it's not easy. Now, how do I maintain the balance? One, I have work schedule. I have a team that helps me with my schedule. Okay, no, Dr. Shino, you have to do this today. You have to do this tomorrow, you understand? And I also have time to sleep, because I try to sleep like 8 hours, even though I'm a resident teacher. Obviously, when I'm on call, I can't sleep that much, but I kind of give myself time. I know when to say I'm not coming for this program. I know when to take a break. I know when to do that. And I also have, you have apps that can help you schedule your time. I think so with that, I maintain a work-life balance. And also, when I'm not at work, I try to relax, vacation, just do something not related to medicine, just to help my mental health. I also talk to therapists also, because I believe that as long as you're alive, you don't have to be... you don't have to have this breakdown before you seek out for help. So I do have psychological sessions with therapists to help me, rejuvenate. Yes.
Thank you so much, Dr. Shino, for your time. We are really glad to have you here today. Thank you for agreeing to do this with us. Thank you, sir.